Norco is a medication used to relieve moderate to severe pain. It contains two active ingredients, hydrocodone, an opioid pain reliever, and acetaminophen, a non-opioid pain reliever. Hydrocodone works in the brain to change how your body feels and responds to pain, while acetaminophen can also reduce a fever. The usual dosage is 1 tablet every 4 to 6 hours as needed for pain relief. It is important to follow your doctor's instructions for the best results. It is best to take Norco with food to prevent stomach upset. Avoid taking it with alcohol as it may increase the risk of side effects. Talk to your doctor about the best timing for taking Norco based on your specific needs. Before taking Norco, make sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. Take this medication by mouth as directed by your doctor, and you may take it with or without food. If you have nausea, it may help to take this drug with food. If you are using a liquid form of this medication, use a medication measuring device to carefully measure the prescribed dose. The dosage is based on your medical condition and response to treatment. Pain medications work best if they are used as the first signs of pain occur. If you have ongoing pain, your doctor may direct you to also take long-acting opioid medications. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. Always talk to your doctor if you feel this medication is not working well or if you have any concerns about addiction. And always tell your doctor if your pain does not get better or if it gets worse. If you experience nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness while taking Norco, these side effects may lessen over time. If they persist or worsen, consult your doctor or pharmacist. To prevent constipation, consume dietary fiber, stay hydrated, and exercise, and you may need to take a laxative. Ask your pharmacist for advice on the right type of laxative for you. To reduce the risk of dizziness and lightheadedness, rise slowly when getting up from a seated or lying position. It's important to remember that Norco has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects, such as interrupted breathing during sleep, mental/mood changes, stomach/abdominal pain, difficulty urinating, or signs of your adrenal glands not functioning properly. Seek immediate medical help if you experience fainting, seizures, slow/shallow breathing, severe drowsiness, or signs of a serious allergic reaction. If you notice any other effects not listed, consult your doctor or pharmacist. This medication contains hydrocodone and acetaminophen, which can be addictive and may cause breathing problems, especially when starting the medication or after a dose increase. It's important to take the smallest effective dose for the shortest possible time to lower the risk of these serious side effects. Avoid taking this medication with alcohol or other drugs that cause drowsiness or breathing problems, as it can lead to severe complications, including death. If you are using this medication, it's important to keep it in a safe place to prevent misuse or abuse. Also, be cautious of other medications containing acetaminophen, as taking too much can cause serious liver damage. It's recommended not to exceed 4,000 milligrams, 4 grams, of acetaminophen a day for adults. If you have liver problems or are giving this medication to children, consult your doctor or pharmacist for the safe amount of acetaminophen to take. Avoid using alcohol while taking this medication, as it may further harm your liver. If you are a woman of childbearing age, discuss the risks and benefits of using this medication with your doctor, especially if you are pregnant or planning to become pregnant. Using this medication during pregnancy may slightly increase the risk of birth defects, and using it near the expected delivery date may harm the unborn baby and cause withdrawal symptoms in the newborn. Before taking Norco, it's important to let your doctor know if you are allergic to it or other opioids, as this medication may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have any brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, or a history of substance use disorder. Norco can cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you can do so safely. If you have diabetes, alcohol dependence, or liver disease, you should use caution while taking Norco, as it may contain sugar and alcohol. In addition, it's important to inform your doctor about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. Children and older adults may be more sensitive to the side effects of Norco, and if you are pregnant or breastfeeding, you should discuss the risks and benefits with your doctor before using this medication. It's important to be aware of potential interactions with other medications when taking Norco. Some pain medications, naltrexone, and certain other drugs may interact with Norco, increasing the risk of serious side effects. It's important to discuss all the products you use with your doctor and pharmacist before starting or stopping any medications. In addition, be cautious when taking other products that may cause drowsiness or breathing problems, such as opioid pain relievers, alcohol, muscle relaxants, or antihistamines, while using Norco. It's also important to be aware that Norco may affect the removal of other medications from your body, so it's important to discuss any other medications you are taking with your healthcare provider. Lastly, Norco may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Norco and is experiencing serious symptoms like passing out or difficulty breathing, it's important to give them naloxone if available, and then call 911. If the person is awake and not showing symptoms, it's important to call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of Norco overdose may include slow or shallow breathing, nausea, vomiting, loss of appetite, sweating, stomach or abdominal pain, extreme tiredness, slow heartbeat, yellowing of the eyes or skin, dark urine, and coma. Remember, Norco is prescribed specifically for your current condition, so it's important not to share it with anyone else. Also, don't use it for a different condition unless your doctor tells you to. If you need a different medication for another condition, your doctor will provide the appropriate guidance. If you are taking Norco on a regular schedule and happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and take the next one at the regular time. It's important not to take a double dose to make up for the missed one. When it comes to storing Norco, it's important to keep it at room temperature and away from light and moisture. Different brands may have different storage requirements, so it's best to check the product package for specific instructions or ask your pharmacist. And of course, always keep medications out of reach of children and pets. When it comes to disposing of Norco, it's important not to flush it down the toilet or pour it down the drain unless specifically instructed to do so. Instead, make sure to properly discard the medication when it's expired or no longer needed. You can refer to the medication guide for more details, or consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.